Hello, everybody. Welcome from different parts of the world. My name is Ndidi Nwaneri. I'm a research fellow in the Global Health Postdoctoral Program at the Normative Orders Research Center, Goethe University, Frankfurt. The Global Health Postdoctoral Program is generously funded by Professor Hopp through the Hopp Foundation and is directed by our very own Professors Rainer Forst and Professor Darrel Moellendorf. Although this event is hosted by the Normative Orders Research Center, this is the first of the independent resource group for global health justice. You can just call it IRG, yearly events. It's the first in a series of seminars that will be organized in the course of the German academic year. Established in 2020, the IRG group is made up of a group of global justice theorists that came together to help support the global COVID-19 response, making visible global justice issues and supports global public deliberation on the profound ethical choices facing the world as a result of the pandemic. As I mentioned earlier, this event is the first of 8 planned monthly seminars and a conference of which we will tell you about more in due course. But why the topic global health justice? This, as I've alluded to, this effort, the effort of the IRG group, derived from the pandemic. We would all agree that global management of the pandemic showed global lack of preparedness for the pandemic itself, for future events like that, and other environmental factors that affect human well-being, notably the environmental crisis. Thus, for IRG, the pandemic revealed the need for deeper reflection on global perspectives on health and environmental justice, which happens to be the title of this inaugural lecture. One could also ask, why now? The pandemic is over, right? And tragically, we've almost gone back to what we used to be. But I think this brings to light the difference between a policy analyst who anticipates and tries to prevent potential challenges and the academic theorist who shows up after the fact. So I'm going to take some liberty with Hegel, who says that the owl of Minerva spreads its wing only with the falling of the dusk. Hegel meant that political theory and philosophy comes to understand a way of life just as it passes away. So it is after the crisis that the theorist has the duty, as well as the luxury of time, to reflect on the issue. So some of the issues that came to the fore for IRG is the need to expand our understanding of global health justice to include other dimensions. As I mentioned earlier, the environment. But it's also important that one of the things that also came to the fore was the distance between theory and practice. So the ethical gap. One of the things that we're trying to accomplish is to think through the pandemic and think as theorists, what were the gaps? What were the ethical gaps? What did we learn? How does this influence how we think about global justice theorizing? What can we add to practice? So while the policy person is trying to prevent harm or anticipate and prevent harm, we have a duty to think about it after it has happened. But we also have a duty and a gap that showed up during the pandemic, the gap between theory and practice. So one of the things that we're also trying to accomplish is to bring theorists and practitioners together so that they can talk more, so that it's not in a situation of crisis, there's that huge ethical gap, and then we're trying to look for where to fit them into or where to fit conversation into. So that is the why global health question, as far as I can respond, and why now question, as far as I can respond. Now, I'm going to hand over to Anna, who is a member of the IRG group, to give us a brief introduction before we go into Darrel's presentation, after which we will go into Sridhar's presentation, and then we'll have a conversation. And please feel free to send in your questions. We've prepared a Google document that Anna will talk about, where we'd like to hear from the audience. What would they like to talk about in future? I mentioned that we'll have 8 more seminars like this and a conference. We want to make it as interactive as possible and try and create an avenue where practitioners will have the chance to interact more closely and formally with theorists. So over to you, Anna. Welcome, everybody. Thank you.
Thank you so much. So it's really a delight to be here and to have you in front, because it's just, you know, completely unusual to have the greatest researchers on the topic just in front of you. So this is our seminar, and this is us. So the IRG, as Ndidi said, IRG is a group that has been working together since 2020, and we've been trying to tackle the problems raised by pandemic. But today we just think, as Ndidi said, that these problems are not the problems of pandemic. They are the problems of global health and global environmental justice. We've been working with many institutions before in the preceding years. So we've been waiting with the Graduate Institute in Geneva. We've been working with the Blavatnik School of Government at the University of Oxford. We've been working with King's College London, and most recently with George Mason University in the US. I also put the logo of my tiny institution, which is the Université de Lorraine in Nancy, France. So we did meetings on global health justice. This was the first big meeting in 2021. This is when I joined the group, to be honest. This is a series of events organized by Geneva Graduate Institute, and this is one of the conferences of recalibrating global justice philosophy in King's College London. Finally, the symposium in the US. And today we are absolutely delighted to be able to work with Germany. Germany occupies today a very special place in the world discussion about global justice and global health, also because the policies that are being decided by Germany are particularly powerful, and Germany impressed us in 2015, of course, by the fact of letting in so many people to help them out. So both the country and the institutions, the institution normative orders, is really exactly the place we would like to collaborate with. So we are extremely grateful and happy to start this collaboration. I'm going to stop here, indeed, the presentation of everything general, but indeed, please do see the link in the discussion of this Zoom. So under this link, you have a document where, as Ndidi said, we would like you to note everything that comes to your mind that is related to the questions that we are raising. This seminar, this concrete meeting and the series of seminars, it is nothing that should be understood as being definitive, right? We are trying to figure out what is important. We are trying to define the terms of the discussion. And in the name of that, we need your input, and we would like to do things with people from all over the world. I'm not going to develop on that. You know what I mean? And please leave anything you think is important. But as far as the questions are concerned to our speakers, please just leave them in the discussion of this Zoom. But anyway, we will find whatever you will write in both spaces. So now I'm just going to disappear because I would like to give the voice to our two colleagues. And one is the colleague from Normative Orders, so Darrel Moellendorf, and one is the colleague from the IRG group, Sridhar Venkatapuram. And Sridhar we've been working together for 2 years now, and we've been trying to figure out how to include the essential issues related to racism, discrimination, gender, queerness, inequality, etc., to thinking about global justice, global health justice, without adopting a perspective that we think is traditional, the perspective of charitable philanthropy of all kinds. So I'm really happy that Sridhar is going to be a part of, he's going to launch this discussion on in our name in a way, even though he's going to leave a little bit earlier. Sridhar is a senior lecturer in global health and philosophy at King's College London, who taught a book on health justice, inspired by the ideas of Amartya Sen in particular, but he did apply them to the questions that Amartya Sen did not touch upon. And Darrel Moellendorf is a political theorist, very interested these days, not only on environmental ethics, but also on Anthropocene. And if you say Anthropocene, of course, you have to see the complexity of the problems involved. So, gentlemen, please, the floor is yours.
Great. So I guess I'm going first, right? So I guess the first thing I should say is just how delighted I am to be a part of this cooperation. I think it's wonderful that Normative Orders is cooperating with URG in this way. And we have particularly you, Anna, and Ndidi to thank for this. You've been prodding it along, pushing it along. And I think it's great that you're doing it. And I really appreciate your efforts. And I look forward to doing much more with you guys. I think this is super exciting. What I want to talk about today is what we've learned about solidarity, international solidarity from the COVID pandemic, and what it tells us about the challenges moving ahead for other problems of the Anthropocene. And in particular, I'll talk very briefly at the end about climate change adaptation, which I think what we've learned about the failures of solidarity in the vaccine distribution doesn't bode well for climate change adaptation. Ndidi mentioned that famous quotation by Hegel, "The owl of Minerva flies only at dusk." There's, of course, a famous response, the 11th thesis from Marx, right? That the point of philosophy isn't just to interpret the world, but to change it. And obviously, both things are important, right? We can't change the world. We can't engage in intelligent efforts to change the world unless we've interpreted it properly. But I do think that one of the important things about efforts like this is both to understand the world, but to contribute to making it a more just place. And that's one of the reasons why I'm particularly happy to be here. So the pandemic, I think it's reasonable to say that the pandemic, the COVID-19 pandemic, was the first pandemic of the Anthropocene. It was the result of human relations with the natural world, and it's sure not to be the last pandemic of the Anthropocene. And it would be important for us to learn well from the failures that were produced by our effort to combat the pandemic. So let me begin with the COVAX webpage. COVAX, I think you probably are all familiar with. It's this effort by the World Health Organization and the Coalition for Epidemic Preparedness and Gavi to try to produce a sort of solidaristic distribution of the COVID-19 vaccine. And on the webpage, they say, quote, "Developing a vaccine against COVID-19 is the most pressing challenge of our time." And this is the important part: nobody wins the race until everyone wins. And I think that that's a very nice expression of solidarity and of a call to solidarity in the distribution of the COVID-19 vaccine. As soon as the SARS-CoV-2 virus was really understood, it was understood that transmission of the virus would facilitate mutations, and the emergence of vaccine escape variants was just simply a matter of time. So it was very clear that it would be necessary to have as broad a coverage globally as possible in order to protect people against the vaccine. So there was this call by COVAX and a number of other epidemiologists for a robust global vaccine program. Virologists around the world were on board with this. But almost as soon as the vaccine became available, leaders of wealthy states bought up multiple vaccines, sufficient to cover their populations many times over, leaving representatives of poor states and people in poor states with little access. So the politics went very quickly away from the ideal of international solidarity and very quickly towards vaccine nationalism. And the result was predictable, so that a young person in the US or the Europe could have been vaccinated 2 or 3 times when an elderly person in Africa hadn't yet received a vaccine. In early 2022, when young people in wealthy countries were getting sometimes their 3rd vaccine shot, only 40% of the rest of the world had been vaccinated. Meanwhile, of course, what happened is that the Delta variant originated in India, a country with relatively lower vaccine coverage, and the Omicron developed in South Africa. And that, of course, just sort of proves the point of the COVAX claim that nobody wins until everybody wins. There was some modeling that was done by Matteo Cinazzi at Northeastern University, and it suggested that cooperation to distribute the vaccine in a more solidaristic fashion would have halved the number of COVID deaths, and it would have saved several million lives internationally if that had been done. So it just, again, this just sort of brings home the point that nobody wins unless everybody wins, that the strategy of vaccine nationalism had this sort of built-in irrational consequence to it. And the problem, I think, can be understood as a kind of collective action problem in the following sort of way, that all states would have clearly benefited, and the citizens of all states would have clearly benefited from broad coverage. There would have been far fewer of these variants that developed in other parts of the world, far fewer deaths overall, millions of deaths would have been saved, but also that no particular state's cooperation was really necessary in order to get the cooperation up and running. The cooperation entailed certain kinds of costs that a state that participated in the cooperation program would have foregone distributing the vaccine as quickly amongst its own population. And in that case, each state could see a strong reason not to cooperate. If they did cooperate and sufficient other states didn't cooperate, then they would look like a sucker. And if they didn't cooperate, it may still be the case that a sufficient number of other states would cooperate and there would be coverage. So that results in the sort of tragic situation in which there's just a failure of sufficient cooperation. That resulted in the condition in which millions of people simply died because of the lack of cooperation. So the vaccine nationalism sort of won the day politically, even though there were very strong reasons for a vaccine solidarity program. And I think it's interesting to try to figure out why that was the case. I mean, the collective action problem that I mentioned, I think, is part of that explanation. But there are, I think, features of the international state system and also features of the international property rights regime that contributed to the problem as well. So part of the problem is, I think, deep in the structure of the international state system, that there's this norm of state sovereignty and state responsibility, and leaders felt themselves to be obliged first and foremost to their own citizens. And this is a problem that's, as I said, it's deep in the state system, and insofar as the Anthropocene continues to present us with problems that require global solutions, the norm of state sovereignty is going to be one that is going to create problems, I think, for humanity. The other problem is the problem of intellectual property rights. That's also part of this state system, or at least as part of the state trading system. In this particular case, states around the world, not all of them, some were much better players than others, but states around the world blocked access to patents when patents could have saved lives. At one point, Oxfam said that failure to release patents was costing 30,000 deaths a day. Germany was particularly bad in this regard. Germany was particularly interested in protecting the patent of its flagship company, BioNTech. BioNTech, of course, developed the patent that Pfizer then distributed. And Pfizer made $37 billion in 2021 by protecting its patent rights. And of course, it was able to do this, as I said, by the development of the patent by BioNTech. And BioNTech received lots of public money to develop the patent. It received 100 million euros in debt financing from the European Investment Bank, and it received 370 million euros in a grant from the German federal bank. So there's a lot of public money that went into this. That suggests that there's possibilities for public leverage to release patents after a certain point. This would have to be a part of deliberate part of public policy, but it's perhaps one area that could be addressed by campaigns for solidarity, future campaigns for solidarity. So what does this tell us about future efforts to respond to the pandemic? I'm thinking in particular about what we might learn from this in regards to climate change adaptation, which I think structurally has some of the same features. It's clear that climate change adaptation, which involves, of course, states or communities trying to protect themselves from features of climate change that can't be mitigated against, right? Sea level rise, crop failures due to droughts, wildfires, et cetera. That states will see tremendous incentive to try to help their own citizens first, right? To try to protect them first, put a lot of adaptation funding into trying to protect their own citizens first. This is going to leave the poorer countries with much less funding to protect themselves against. And of course, many of these countries will be the countries that are most vulnerable to climate change. But the problem will very quickly become globalized as poor states fail in their adaptation efforts due to lack of funds. The refugee crises will only increase, and we'll very quickly see that adaptation is not something that can just be solved at the local level, if indeed that's the way it goes. So the problems of international solidarity that were apparent, I think, in the vaccine case could come back with tremendous force when it comes to the climate change case and climate change adaptation in particular. And of course, the worry is that this is just these are just one and two kinds of problems that will develop in the era of the Anthropocene. And I think a great challenge for us moving forward is how to think about how we can foster international solidarity, what kinds of levers we can push to develop a politics of international solidarity. And I think I'll stop there.
Wonderful. Thank you so much for putting together these topics of environment and health. And I would like now, Sridhar, to talk about the philosophical aspects of justice on the global level. Sridhar, please.
Thank you so much. So once again, thank you very much to Ndidi and Anna for putting together this first of a series of seminars. And also thank you very much to our colleagues at Normative Orders for making a fine selection of Ndidi as your research fellow in this project. So congratulations on that choice. And then also your willingness to do these activities and help us engage with you as you do them. It's a very exciting prospect. I've been a huge admirer of Normative Orders for over a decade or more now, when I first was a graduate student. So it's very exciting for us to be able to work with you and think through some of these things. So as we said, I'm going to talk just for a few minutes about the perspective of someone who works in what's called global health on questions around philosophy and political philosophy of global justice, and what we've learned and what I think we need to do in the future. So usually, whenever I give talks in the West, I stick to 3 points because most people in the West like the 3-point model. But there's so much to say that I'm going to actually say 5 things, and I'm going to try to make them quick and clear. So the first lesson for someone like me, and for I think any political philosophers who's interested in making a difference in the world, is what role for political philosophers now, and what role for political philosophers in global justice now? And this, I think, is a really important question. For the reason I say this is because, for at least 15, 20, 30 years, people have been working on the concept of global justice, but during the pandemic, I saw very little input or engagement by philosophers and political philosophers with this problem at whether at a national level or a global level. And one of the reasons that we have IRG is precisely in order to somehow engage political philosophers with a global health crisis. And one of the things that became very clear is many of our global institutions do not have the capacity for ethical reasoning. And I don't mean as individuals in their professional virtues, but I mean in their institution, the ability to see problems not only in their economic or security or scientific analysis, but from an ethical analysis. I'm going to sort of take a risk and say they are inherently doing political analysis all the time. So at an individual level and as an organizational level, they're constantly thinking about strategy and how we can do and what's going on. But in terms of ethics, about what's the right thing to do, but also in terms of equity, in terms of, who benefits, who doesn't, what do we do, what should we do? And it's incredibly clear that whether it be the United Nations, whether it be as a system, but the World Health Organization or UNICEF or Gavi or Global Fund, they do not have someone or a group of people that works through problems from an ethical perspective. What they do have are people, usually lawyers, who are trained in human rights law and who are able to basically say, this is what the law says, or we should do, etc. But that doesn't necessarily influence difficult and ambiguous problems. So it's a question not only at a theoretical level about what is the role of political philosophy and philosophy in the world today and in global crises of today, but our global institutions simply do not have the internal reasoning, ethical reasoning capacity. And I'm going to come back to this. And that's sort of a starting position. The second thing is that I think many people who work in political philosophy and philosophy often have relegated health issues to the margins, particularly to bioethics, that somehow whenever it comes to health, we are talking about health care and access to health care, and that this is more about sort of healthcare equity, and that this is very much sort of not real sort of questions around social equity and justice. So many of us, some of us, have been working to move this story along. So some of us on the screen have been working on something called public health ethics. That is, how do we deal with ethics in health issues and health policies beyond the clinic and beyond the research setting when we're making public health policies. And then there's some of us who are actually looking at a much broader level, that health inequalities are created and distributed according to the nature of the level of justice, or the kind of justice of basic social institutions. That how fair and well these social institutions are running is going to be reflected in how healthy the population is and the kind of inequalities the population is. What the next level of that argument, which has been made implicitly by many people, but not so much on an explicit philosophical level, is that the health of the human population is a reflection of how just the global governance and global architecture in the world is. It is not just about access to health care, but about the fairness of different kinds of norms, laws, values, operations, etc. And I think we can see, whether it be the pandemic, the diverse responses to different kinds of humanitarian crises, the different kinds of issues that are going on now, that people live and die in different ways based on the different kinds of different institutions and what they do and how they do it. So what is the issue here is that without the lack of engagement by political philosophers and global justice philosophers at health at this kind of level, we have essentially bioethicists and also a growing number of public health ethicists who are essentially doing the best they can to deal with a wide variety of issues. But the intellectual resources that they have are limited. So 4 bioethics principles are not sufficient to deal with the variety of range of problems. And even some public health ethicists might still try to come up with some sort of principles and try to apply them everywhere. But I think that some public health ethicists and also people who are working on health justice philosophy we understand that we need to be thinking about this in terms of theories of social justice or theories of global justice. It is not only impossible or inadequate to apply 4 principles to all global health problems, it's also dangerous and unhelpful. So when we have questions around the health of states or peoples or nations, sort of trying to figure out how the principle of autonomy or beneficence or non-maleficence addresses the health issues of problems, can come out with a great publication, but it also could be quite harmful in terms of the great amount of injustice that it tolerates or obfuscates or elides. And so I think that there's a great urgency to bring our intellectual resources from political philosophy and global justice philosophy to issues around health. So going back to global justice philosophy that was so flourishing after sort of at the turn of the millennium, one of the story that I tell my students and other people is that, why global justice philosophy flourished a lot is because of, the downfall of communism and this idea that we now have a global, on our way to becoming a global democracy, and therefore there's this rise of cosmopolitanism sort of prospect. And so there was a great optimism that this is the way to go. So the other thing that I would say is that the AIDS epidemic was significantly influential in our understanding of international empathy for people like us in other places who are also dying of the same thing and might, don't have access to medicines like we do. And then there's also been a long-standing global feminist effort to protect the health and well-being of women around the world, but particularly in poor countries who were the subject of abusive fertility control policies for most of the 60s and 70s. And so to overthrow a global agenda was also required global solidarity and activism. So for all of those things, I think some of those threads came through in the global justice philosophy in the 2000s, but some of the things that didn't come through was that it didn't have to be all about access to medicines, and it didn't all have to be about economics and development. So there's been a lot of emphasis in global justice philosophy about economics, as is about money. There has been very little epidemiology about the causes and distribution of disease and health. And you'll see this all the way in theory of justice of Rawls, who spends lots of time on economics, but doesn't seem to have sort of a basic appreciation that living together is not necessarily good for our health all the time, that there's also health risks from being able to be social, and we should think about that more. And we need to think about that more at a global level as well. The thing that the pandemic has done is that it has, for those willing to see it, shown that we are interdependent, that political borders are not only important and quite significant for political power, but actually in the modern world they're quite porous, and that viruses and other kinds of non-infectious threats travel across borders with people, just like people do. So as things move, whether it be capital, ideas, people, so do health threats. And so we do have a lot of interdependence in terms of risks that come across. But in that interdependence, there is a great amount of unequal risk. One of the unique things about this pandemic that some people see, many people don't, is that if this pandemic, like other outbreaks, had started in a poor developing country, there would have been a serious intervention at the source, as has been done in very different African countries. In this particular case, because of the size of the country in which the outbreak went, they were not able to intervene inside that country. And as a result, what we see is that that threat moved from cosmopolitan city to another cosmopolitan city. It's one of the first global health threats or risks or crises that actually affected rich countries first, because they were connected through metropolitan airports, and then it moved down slowly towards low-income countries. Usually we're seeing the story, or we are used to seeing it, that somehow a health issue is a poor country problem that will then affect rich country. This inequality is very clear to people in low-income countries, and they see that as being unfair, that both they're suffering issues that are local, but are also historically caused and out of deprivation, but now they also have to deal with other health issues that's because of the global architecture that is unfair to them. So I think interdependence is one concept. So before solidarity, there has to be some recognition of this interdependence and the unequal risks and threats that come through it. We also have seen the revival of some things that people have not been talking about or don't want to be talking about, which is the return of racism in international relations. That was a very big issue up until sort of the 1970s and 80s, when different kinds of policies sort of pushed that to the back. And what we've seen in the pandemic is a clear sort of articulation that this is ever present, and it's clear and it's shown in many different ways. We have seen that there's still, in terms of international organizations, the lack of representation of women in leadership positions, but more importantly, in the pandemic response, you will see that no matter which country had a response, the impact of this global crisis is different on girls and women, and yet they make up more than 50% of the population, but no national pandemic response was actually tailored towards their needs. So majority of the population affected differently and specifically, but the response, no matter what kind of response, was not tailored to their needs. And it's still a continuing problem as well. So it shows that this is one of those things. And so there's many other things that we could talk about, but I want to say that we have a return of things that have been persistent, rather than this pandemic being a unique event that will return again. I prefer to think of it as what Amartya Sen has taught me and others, that famines are not exceptions. They're an acute expression of endemic problems. And an analysis and a theory needs to be able to explain both the acute event, but also the persistent and endemic problems. And so I think that this is one of the things that we as political philosophers going forward need to think about. So I'm going to end it there. And I want to once again say thank you very much for this opportunity, and I'm really excited to be able to sort of start this conversation or build on this conversation, and looking forward to all of this. But again, I also want to point out what Anna and I think Ndidi picked up is that one of the exciting things about this particular seminar series and activities is that it's about interacting with Germany. And so the political philosophers or philosophers may not know it, but Germany has become one of the most significant national actors in global health policy. They have impacted the way that the WHO is funded. So after decades of the WHO not being funded well, they have come to an agreement, or they have brokered an agreement in which countries will pay more. They have been brokering different kinds of agreements for the reform of the WHO. There is an annual World Health Summit, which has become now a de facto global health summit that happens in Berlin every year. They've also, as I think Germans do, organized one single platform in which every academic who wants to do global health research signs up to it, and they all work together and announce it. And I think that it would be a great thing if lots of German philosophers also connected with these German health practitioners, which we hope to do in these seminars. So thank you again. And so Darrel, I want to, I guess, open up this conversation with you to see whether you have any questions for us or any comments for us. And then Professor Forst, please, if you want to also intervene, I want to make sure that if you have any thoughts, you also get a chance to jump in and stuff. I have to apologize to everyone. I have to leave. I have to teach on the hour, so I'm going to leave about 10 minutes before in order to walk the class. But Anna and Ndidi will have safely take you forward from there until the end. So Darrel and Professor Forst, over to you.
So I'll just say one thing, and then I'm sure Reiner will have some things to say. But so I think that in my case, I'm very much symptomatic of this neglect of political philosophers with respect to global health ethics. I had no idea of Germany's leadership in this regard that you mentioned. It's fascinating to hear, and it does seem, I think you're right, it does seem like a place in which German political philosophers could play a larger role, and that's exciting to hear about. But yeah, the fact that I didn't know about it, of course, is revealing, right? Of course, I'm not German. I don't know if that gives me a pass in this regard, but it does suggest that I don't know the ins and outs of the system the way other people might. But yeah, that's I think you're right. I think that is something to think about, how we might be able intervene. But Reiner, I'm sure, will want to say much more, and I know he has to go soon too, so I think it's best to let him talk if he'd like to.
Thanks so much. Very kind of you. I will take the privilege of you asking me to say something. First thing is that I'm thrilled to see you all here at the start of this seminar, and I very much look forward to further occasions, and if things go well, to many of you having here in Frankfurt. It's a great pleasure and an honor for us to be part of your discussions. My question is basically one that, if I get it right, connects Darrel's and Sridhar's talks. Is our plea for global solidarity, does that depend on us dealing with dangers that make us all similarly vulnerable? Darrel pointed out that the variants that developed of the virus are a result of a maldistribution of vaccines, and so these variants haunted all, including those who had not shared the vaccine properly. So the argument seems to be one: if you're not solidary, you will all be equally vulnerable. So it's part a self-interest, but I don't want to say it's narrow self-interest, but it's an argument about, you know, all being in one boat. And Sridhar also pointed out the interdependence when it comes to a pandemic and to dangerous viruses. So do you both think that you need to make an argument for that shared vulnerability in order to appeal to solidarity? Because we could also imagine an appeal to solidarity as based on justice doesn't require shared problems in pointing out structural inequalities and structural injustices that lead to asymmetrical vulnerabilities would be an argument of justice that could be transformed into an appeal for solidarity. But so is the appeal in your eyes stronger, and does it require that kind of argument that we're all in the same boat?
Shall I answer, or how do we proceed?
As we wish. There's no rules. There's no, yeah. As you wish.
So, right, and this is a discussion that you and I have had before in person, in a room in Normative Orders. So I was taking the COVAX webpage as expressing a characteristic expressing a characteristic sort of sentiment of solidarity, right? Nobody wins the race until everyone wins. So I interpret that. They don't use the word solidarity. I interpret that as an expression of solidarity. I don't think it's an expression of equal vulnerability. I mean, I think that just wasn't the case in the COVID the COVID pandemic. But it is an expression of a kind of shared vulnerability that in order for there to be the protection that even the wealthier states wanted, there had to be a very different distribution of the vaccine. So I think it's a shared vulnerability, but not a shared equal vulnerability that I think is expressed both in that statement and I think what was revealed in the subsequent failure of solidarity, revealed by the practice of solidarity.
So I'll just take two thinking out loud answers. I'm not going to hold these two answers in the future, maybe. But I think the first question is the idea of shared vulnerability implies that we make each other vulnerable, and therefore we need to act in solidarity in order to manage how we make each other vulnerable. So what the pandemic and the way that nation states acted was precisely that even if we make each other vulnerable, we are going to act individually to manage our own risk, and we don't care about you. And in the beginning, the story about what is causing the vulnerability was, unaware, and people don't really sort of couldn't get their head around it. But this idea of what makes each other vulnerable is also important to think about. What is it that we are doing to each other that makes us vulnerable? Because we might have something to say about some things are, okay, and some things are not. And so that sort of basis of vulnerability is something to think about. But then if we are, sort of vulnerable equally, and in the beginning of the pandemic, everybody assumed that everybody's at equal risk. And as time went on, what we realized is individuals are not, and nation states are not. And they're going to act as fast as I can in order to buffer their protection, so solidarity will have to have something to say about that as well, which is, what do we do and something like that. So that's one part that, some people might want to pick up on. The second thing is that when it comes to vulnerability, what some sociologists and health sociologists, and I think philosophers have said, is that as human beings, we have two things in common. We are born and then we die. And so this is something that no one can escape, these two things. And death is not something that we can escape. And that the body is something that will go through a life cycle, and it will actually get sick, and it will actually stop. That notion of embodied vulnerability should be the basis for many things. So whether that be sort of, basic morals or human rights, etc. And so rather than basing solidarity on how do we make each other risky, we could also sort of say, here we are in this sort of thing, in this body that will go through, and it is quite sort of delicate, it is vulnerable, and therefore that is some of the basis that we could think about in solidarity. So those would be two ways that I would think about it. At this point, I want to apologize. I have to go teach, but Ndidi and Anna, please take over, and thank you all very much for this lovely start, and I look forward to seeing you all again. Bye.
Bye. Thank you.
Thank you, Sridhar.
So there are now people with hands up.
Yes. Chinedu had his hand up first. So Chinedu, the floor is yours. Do I need to mute him? Sorry, unmute him?
No, he's able to do this by himself.
Are you able to unmute yourself? Please go ahead. Chinedu.
Okay. All right. Thank you for this wonderful gathering. Whenever I see issue of global justice, even though it's not my area, but I like to peep in to know what is going on, because if you are not directly affected, you're indirectly affected. Because we are talking about health and the global justice. My question takes off from the issue of shared solidarity, and I take it from the angle of cooperation, which Darrel mentioned during his presentation. And in this kind of concept of solidarity, just like Sridhar said, we make each other vulnerable. But however, we act individually. And most of the times when we talk about vaccine distribution during the pandemic or after the pandemic and all these things, we always, or issue like this, we always talk about the dialogue between the North and the global North and the global South, the imbalances in the power equation or power distribution. But the issue of cooperation that I mentioned here provoked a thought in me about citizens' refusal, people's refusals to be vaccinated in such situations. Sometimes I see it, is it not a kind of trust deficits on government institutions that the people, some people, it's not only in the global south, it also happened because during the pandemic, I was studying KU Leuven. So I know a good number of people, Belgians, who refuse to be vaccinated. Sometimes I incline to see it, maybe these people do not have faith in the government institutions to be allowed to be vaccinated. I also have in mind the principle of autonomy that you cannot give force any medical intervention on any persons. So my question here borders on now, how do we overcome such problem in terms of cooperation on the part of citizens for similar situations, not only in vaccine distribution, but other, because there are a lot of health challenges plaguing the world. How do we now tackle such problem?
Thanks for this question,
Takers?
which is like a huge question. Like, you know, I wonder to what extent we are able to answer this like directly, but maybe Darrel would like to add something to as a follow-up. Or if
No,
don't.
No.
So thanks so much for this, but you are much too ambitious. Let's just stay with us for the upcoming months, and maybe we will find out how to start the answer. But at this point, it's much too early. So thanks so much for this. Rioa, please.
Yes, hello everyone. So I'm Rioa Chong. I'm co-director of the Center for Research in Ethics at the University of Montreal, but it comprises members from 7 universities, McGill, Concordia, and anyway, so, and I'm a member of the IRG group. So it is quite exciting indeed to be in conversation with the good folks at the Normative Order Center. So it's wonderful. And thank you, Ndidi, and thank you, Anna, for organizing this. And it's also very nice to see so many friends attending the workshop as well, the webinar. So I just wanted to perhaps go back to what Rainer Forst, I think, was getting to. So there's a prudential argument and there's a normative argument, I think, to be made to defend or to promote more robust international cooperation in global health. And it is something that I find extremely interesting, the articulation, the very complex articulation between prudential, instrumental reasoning and, ethical, philosophical, normative arguments as well. And I think that's something in Darrel's presentation also hinted to that when you were, for example, invoking the cooperation dilemma, resonating with the prisoner's dilemma and the sucker's trade-off and all of that. There's something of the game theory also applying as well in climate change and the failure of cooperation, and as well and in the context of global health and in the pandemic. So what I find interesting is that obviously and evidently, normative arguments don't suffice to appeal to the various actors in the complex constellation of global health governance. So we tend to rely on prudential arguments, all for one for all, and the quote that you were also citing, Darrel, from the COVAX webpage. But the problem with the prudential argument is that there will always be a way for selfish nations to understand and read their own self-interest in a very selfish way. For example, the case of health nationalism, there is a legitimate case for arguing that in a consequentialist division of labor, it is legitimate for all states to take care of their population first. And if everyone does so, then, together we will build some kind of a collective immunity. That was the argument that people like Emmanuel's at the NIH tried to defend. But, it was a reasonable account of health nationalism and of moral partiality toward our co-national, because they actually try to quantify something like, if we can get to 3 or 6% of our population, then we can start to share our vaccine with other countries. That is a case of, I think, reasonable self-interest. But what is happening is that during the predatory race to vaccine, we actually saw expression of moral partiality beyond what is reasonable and beyond what is justifiable in some cases. And what is interesting, I find, is to analyze the phenomenon of the securitization of health. And this phenomenon that was coined in the aftermath of the World Trade Center attacks was a call for all states to perceive health issues and to elevate them at the status of national interest, of national security. And we see that the health nationalism that was expressed in the predatory race to the vaccine expressed that kind of prudential reasoning to its extreme, which is why I think it is quite important as philosophers to come back to build a stronger, I don't know how to say, but more convincing, maybe not more convincing, but we need, I think, to build on the unconditional argument that justice and global health is as necessary as the prudential arguments. And also, I just wanted to point out that the COVAX scheme relied on capitalist philanthropy rather than in a sense of justice. Although I think that the leadership of the WHO was very sincere and genuine when Dr. Tedros, for example, was campaigning for vaccine equity, I think that his moral leadership was very sincere. However, we also have to understand that when hundreds of countries led by South Africa and India asked the WTO to waive the patent on the vaccine, as we all know, that was a moral failure in terms of international cooperation, because states were the most advantaged and most wealthiest states of the world, including the European Union, Canada, United States, Switzerland, Japan, refused to waive. And what is also interesting is that something is needed to fix the constellation of international institutions, because in this current scheme of global governance, WHO and WTO have no relation whatsoever, because actually WTO is not abiding to any UN institution. So that is also, I think, a structural institutional design failure. And I think that it points to all the, the multidimensional and very complex constellation of challenges that we must confront in order to help promote greater international cooperation in global health. So I don't have a question. Well, maybe I can phrase this question. Darrel, what do you think about the limits of prudential arguments? How your own work in climate justice, why do states don't see that it is in our most enlightened self-interest to actually cooperate rather than to go against the Kyoto Protocol or the Paris Climate Treaty? Why this short sight?
So that's a big question, and I think the answer is different in different cases. But I don't see solidarity as necessarily prudential or necessarily moral. I think it depends upon what the ends of solidarity are. So I think in the case of the vaccine distribution, for example, to call for solidarity is to call for saving millions of people's lives. So I think solidarity in that case is solidarity in the interests of a moral cause. I think in the case of climate change adaptation, it's solidarity in the interest of a moral cause. But solidarity could be purely in the interest of a prudential cause. It could be purely in the interests of of things people want. It could also be in the interest of something that's blatantly unjust. So I take it that solidarity, whether the sort of the extent to which the call of solidarity is a call of justice or a call of prudence or a call of injustice can vary by the circumstance. That's just another way of saying that I think that solidarity is not, my understanding of solidarity is not a moralized one, that it can be deployed and used for various different kinds of ends. I think in the case of climate change, and this was also partially the case in the vaccine, is that there are powerful vested interests. In the case of climate change, it's the interest of the fossil fuel industry that makes cooperation so hard, and that prevents states from doing what would clearly be better for the climate, and in that sense, better for everybody. The fossil fuel industry has given lots of money to politicians. It's developed all kinds of campaigns to try to convince people that we can that it's either not a problem or that we can move more slowly. And that's I think the major political problem in the case of climate change mitigation. And I think we would have to look in each particular case to see what the holdup is. But I tried to say in the case of the vaccine distribution, which I'm really no expert at all on, but I tried to point to what I thought were some of the barriers to solidarity in that case, the norm of state sovereignty, which is something that I think is going to get in the way as we try to cooperate in the Anthropocene, and but also the way in which intellectual property rights protects the interests of the corporation to develop the vaccine. As you pointed out, there was this effort by India and South Africa to try to develop a waiver for the patent, and it was many countries, including Germany, were very vociferous against that effort. So again, there's vested interests at stake in that particular case, but that's not always going to be the case. There's going to be other problems. There's going to be other problems in other cases, I think.
Thank you, Darrel. I'd like to call on Anna. Would you like to say something about solidarity? It's something that we've really, really discussed a lot in the group. Would you like to say something about solidarity?
To be honest, I wanted to say something about what Darrel said, namely something about the. I wanted to know whether he did think a little bit about the question of epistemic injustice or justice or whatever in the context of fossil fuels. I'm explaining myself. So, for example, let's take a country. I'm taking something very simple. Indonesia, a country that was in the relationship of dependency from many. It was colonized. They had many troubles in the recent past. So this country would want to be as independent as possible from the point of view of energy. And the thing is that their energy comes mostly from gas and from coal. They are super rich in coal. And if they would like to have some greener energies, namely the energy like atomic energy or some nuclear energy or something like that, they would start to depend on countries that have the minerals that allow them to produce nuclear energy. So we are in a very, with Indonesia, we are in a very tricky position of a country that would like to have its voice, so would like to decolonize finally, but the issues related to their energy and their development put them in a position of suicidal position, because as we know, Jakarta is moving. I mean, the capital of Indonesia is moving from Jakarta to some other islands. And everything is collapsing because of some contradictory imperatives. And I was just wondering whether you thought about it, because this is something that I think is really essential today. And so any thoughts?
So I don't know anything at all about Indonesia, so it's hard for me to respond. But you asked it in the context of epistemic injustice, and I guess maybe you could just clarify
So they want their voice to be heard. So this is the part of epistemic justice. So how to it's a general question. It's not about Indonesia really. It's just a very handy example. So how to talk to countries that claim that they want to become independent using their own fuel energies, and it's not only I could quote Uganda or Tanzania. With some more complex international interest of total whatever, but countries that would like to intensify the use of fossil energies in the name of independence. Yeah.
So I think states have an obligation to their citizens to address the problem of poverty and to pursue. I think the one way to do this is to try to make advances in human development according to the Human Development Index. That's one measure of that, but to eradicate poverty is an obligation of states, and I think they're fully justified in wanting to pursue paths of the production of energy and the use of energy that facilitate that. And of course, that's a problem for the global community that wants to achieve climate change mitigation and net zero. And I think that suggests that there's just an enormous obligation on the part of the highly the high income countries, the most highly human developed countries as well, to provide either the intellectual property or the technology or the advice or the funding to states like Indonesia, so that they can make this transition away from poverty and towards greater human development. Is that a problem of epistemic injustice? It is, I suppose, if their voice and if their demand about the importance of poverty eradication and human development in their country isn't being heard, then I think it is a case of epistemic injustice. Although I think in the international negotiations, this is a problem that's at least recognized. That's not to say that it's not responded to, that it's responded to properly, but I think it's at least recognized that, it's codified in the United Nations Framework Convention on Climate Change. The right to promote sustainable development has been there since the beginning. The problem, of course, is in the practice.
Okay, thanks for that.
Thank you. Would anybody like to make a comment? Anna?
Sorry, no. I'm happy. So go on, please.
Okay.
Sorry, what was your question? Excuse me, I didn't hear it really.
No, I was just wondering if anybody would like to comment on the last two things that was said. We moved from solidarity we have moved into climate mitigation or climate change, responding to climate change. I'd like to say something in the absence of anybody saying anything. I don't want to hog the space.
There is a question.
Yeah, there's a question from Jan.
Where? Okay.
Yeah.
If you don't mind. Thank you.
Oh,
so I'm Jan Heilinger.
I'm one of died behind the books. I didn't see it.
No worries. I'm Jan Heilinger. I'm one of the few, I would say, political philosophers in Germany who has a long-standing interest in health and health justice. And I'm very happy also to see some familiar faces here again. That's great. I wanted indeed to come back to the solidarity issue again. In particular to Rio's comment to Darrel and her diagnosis, that it's really stunning. You wonder really why there is not more global solidarity about these very important issues, no matter whether in global health or in the climate crisis, simply because of the immense self-interest everyone should have here already. But I can only guess. I think it's, as it has been said, also vested interest and the possibility for some to still advance their own particular interests that Trump's then attempts to be more show more solidarity. But this is, of course, one of the big challenges of our time. I wanted to make 2 points about the solidarity notion that are meant to strengthen the normative justification and reasoning for it. I think it is important, and you might be very, very well aware of the fact that solidarity is possibly also in an in-group concept, and an in-group concept where there are no moral criteria for who counts as the in-group. In a maybe somewhat innocent context, it might be the nation state, but it might be also a solidarity among the gang of gangsters, or a mob solidarity, and so on, as it has been much discussed to show how solidarity is very problematic unless we have additional normative criteria. And I think we need them here too. And if then solidarity extended to the global level, and truly so, then it is an unproblematic concept, even morally valuable, of course, but we have to be specific about who is counting as deserving of the solidarity. And then another important point why the normative justification of solidarity seems so important to me and others is that if we stress the instrumental justification, it is likely to backfire in the moment where their instrumental justification fades away. This is also known from other contexts, like in Germany, we had and still have a long discussion about the integration of refugees. And there is a lot of positive arguments to be made in favor. It's good for us, for our economy. We need the work. We need more people to pay for our pension schemes and so on. So it's very valuable to have them. But if you stress these arguments, you undermine the primary and more important normative justification that should be at the center, and that should also be upheld the moment the instrumental interested justification fades away. And that's why I think as political philosophers and as reasonable people, not necessarily only as philosophers, we should really make a normative case here for solidarity, because it is so essential that this is the basis. Of course, I'm not overly optimistic that this will cut through the resistance of those who hope to make money or whatever, have other interests in that case. But we must not fall prey to giving in too quickly and then stress issues that might be effective on the short run, but ultimately risk to undermine what we should hold dear and valuable primarily.
Thank you. Thank you. So would anybody like to say anything else on the subject of solidarity? Because anybody? I can't seem to see any hands. No.
But Ndidi, if you want to add something, please, it's perfectly the moment.
Yes.
We only have
I was going to, so in the course of during the pandemic, we had a conference where I played around with the idea of the utility of care, was what I called the presentation. So when we think about, so we're talking about solidarity, for me, it derives out of the notion of caring for the other. Now, however, care has been feminized. Care is always, in philosophy, care of the other is almost, it's something those feminists talk about. That is how it's dressed up, right? And so I was engaging with the idea of care as a philosophical concept, and I couldn't separate care in my mind from utility, the utility of care. So bad example, maybe a child or a pet or a neighbor or somebody out there. Let's say someone wants to fall, right? Is there something in it for me if I care for the person? So there's also this argument about how there's no such thing as pure altruism. So maybe we want to look for a grounding of care. And then when we think about it, that's the way I'm trying to think about it, but I'm not very clear about it. So care becomes a yardstick, but what derives from care ceases to be put in front. So I protect myself if I care for the other enough to make sure they get a vaccine, for instance. However, my point of departure is not the fact that I'm going to protect myself, but my point of departure is the shared humanity of the other. If we could frame it like that, it ceases to be, because now it seems to be one or the other. Are you caring in a non-interested way, or are you caring for the other because you don't want the person to develop a new variant and give it back to you. You don't want the person to deprive you of something in future. Therefore, you protect the person's interest today. That either or, if it's inevitable, maybe we want to put first. For me, solidarity is not far from care of the other, because from solidarity, you will derive care. And if you care for the other, you will express some form of solidarity. So I'm talking about this group of ideas. The instrumental, what derives from it? If we're going to make an argument for it, if we focus on what we derive, we weaken the argument, because we can derive those things without making an argument for care. But I feel that care and solidarity and those group of ideas end up protecting us. But the question is, which is the cart and which is the horse? And I'm still so what comes first? I guess for me, that's the technical part that I haven't quite worked out. How do you frame it in such a way that your point of departure is care, but there's still an argument to be made for I protect others, therefore my well-being gets better, or I protect myself in the future? Comments, questions, anything? We have another 5 minutes, so speak now or forever hold your peace, or else I am going to unleash questions. I might even pick people.
But did you your question was rather to Jan or to Darrel, or in general?
In general, any takers, because we're trying to make this interactive as well. In future iterations of this, we're going to have practitioners present, and we're going to make it as interactive as possible, because we're hoping that, there's a cross-breeding of ideas.
Yeah, so as a follow-up to what you said, because I think that your question is perfect, and kind of the tension you put forward is perfect. I would like just to go back to Jan for a second, because I was wondering, is it really a perverse way of seeing things that I have, which is the following. So I would rather first ask myself, who are the people or institutions or countries who are resisting to the call of whatever, if you want to use the word solidarity, let's go for solidarity. So I was, when I was working on vaccine distribution, because it was my obsession for a year, I was trying to figure out, what are the reasons that are advanced by those countries, but this country, just to try to figure out how to destroy these reasons, not in the name of some general principles of justice, but rather in the name of, I don't know, coherence with your general politics. So I was just thinking whether this could not be, whether this kind of path is despicable, or this is a prudential path, for sure, but a prudential path that is, again, not trying to figure out what are general prudential notions that we can find, but just to ask who is the enemy, and to think in terms of the enemy and how to destroy his argumentation. I'm not sorry, I understood correctly. Did you mean that you were interested in finding out why these asolidaric nations, so to say, behaved like they did? To find their genuine motivation and to show that it is false, right? Just like I find this is your motivation. I'll show you that this is incorrect. It is incoherent with other principles that you are holding. So it was the case with the US, I think. And at the end of the day, Joe Biden said, go on for patents, right? At some point, Joe Biden did say that he was in favor of waiving the patents, because he understood that to preserve patents in this context was contrary to America, really. And not to justice, not to the general idea of justice, but to what are the American commitments, in other areas.
Jan, would you like to respond, or should I that my own
just maybe two words. I think there's a certain hypocrisy, a certain me first approach, and a certain ability to act like that because of a position of power. And this combination suffices to make those who can behave narrow-mindedly in their own interest, no matter what they preach and what they say and what they even might hold dear elsewhere. People can live very well with a certain, so to say, discrepancies in what they say and what they do. And this holds true for countries too, I fear.
Can I respond to, but I know you want to respond, Ndidi, so why don't you go first?
No, I was just going to talk about the elephant in the room, and the elephant in the room is capitalism and money. Why would I want to, as a government, right? At the end of the day, politics, especially in a place like the US, is tied to money. And I think the people that were acting up with regards to vaccines, they didn't want to set a bad precedent. It's all about money, taxation, the pyramid. And as long as that pyramid exists, self-interest becomes, yes, I know that everybody should get the vaccine, but I'm not going to harm the person that's going to make sure I get elected in 4 years' time. I guess that's how I saw it from the outside. Please.
I think that's part of the story. I mean, I think the motivations of these leaders is complex, and it's hard to say in any particular case. But one of the things I want to say is, I mean, if you go back to what I've been trying to stress, the structure of the international state system, right, and the norm of state sovereignty, these leaders also have responsibilities under that system, right? They have responsibilities to promote the interests of their countries, and that can be read as a normative, a moral responsibility, right? I mean, it's not, we talk about self-interest, and there is clearly a way in which that's self-interest, but there's also a way in which, insofar as under an international state system in which they're conferred by the norm of state sovereignty, they're conferred to be the person who has the sort of fiduciary responsibility to their citizens. Then when they act on the basis of that responsibility, that's also they're also acting in a way within the context of that system that's morally defensible, right? But I mean, part of the point of solidarity in this particular argument is that it just doesn't work, right? It didn't work out in a way that would protect the citizens of those countries because of the nature of the transmission of the virus and the way that it mutates. So although I understand why people talk about self-interest, I think the case for vaccine nationalism is slightly more complicated than that. I think that there's a way of reading this, not because I like these state leaders, I don't, right? But there's a way of reading this in which they can legitimately defend the claim that they're acting on the moral interests that they have to their citizens, and that's why I think the problem is more of a systemic problem than a problem of just sort of the self-interested nature of a particular state leader.
And so, I mean, to what extent is it proposal to destroy the nation state system?
That's not going to happen, right? But I think what it reveals is that over the course of the Anthropocene, which presumably is going to be a very long time, right? That part of what needs to give way, and it will happen, I'm assuming gradually, but part of what needs to give way is the norm of state sovereignty, and presumably it will happen piece by piece over time. In this particular case, what we need, I think, is some kind of really robust international organization that has some kind of authority for global health affairs, right? And that has to be something like a mid-range goal, I think.
We do see, in what you say, the shadow of the title of your latest book, Mobilizing Hope. Yeah. First, you do think that we are still going to survive for a long time, which is not exactly shared as an opinion, and then you think that these institutions are going to exist. So I'm really happy to see this kind of optimism.
So on that note, unfortunately, we have to end this meeting. I'd like to thank everybody that took time out to attend. I want to thank, of course, the normative orders, the IRG group, and everybody that worked so hard to make sure this happened. We're going to send out information over the next few weeks, or over the next week, about all the other seminars that we'll be holding, as well as the conference. This was the inaugural one. Thank you so much for taking your time out. Remember to send us any message with regards to what you would like to see in upcoming seminars, and we'll keep you posted on the contents of the seminars and the dates and the speakers. We'll have all of that information ready for you in another week, maximum 2 weeks, okay? So thank you, everybody, and thank you for your questions. Thank you for your time. Thank you for showing up at ridiculous hours of the day from different places. And thank you, IRG. Nice to see everybody from the IRG group. So cool to see everybody. Thank you, Darrel, as our host. And I look forward to the next meeting.
Thank you, Ndidi. That was a blast.
Thank you,
everyone.
A great discussion.
Bye-bye.